I caught COVID from one of the patients I was looking after, and I was in with him, and everyone was knocking on the windows telling me he's positive. So I was just in there thinking, this isn't going to be fun.
My name is Caitlin Anderson, and the course I study at university is Diagnostic Radiography and Imaging at Cardiff.
I'm Joe Walker, and I'm doing adult nursing in Swansea Uni. I knew I wanted to do it when my gran was ill, and I looked after her then, and I didn't have any idea what I was going to do. And my mum was like, "Why don't you try nursing?" So I was like, "Well, I've managed with my gran, so I'll be able to do it here."
I think there's a lot of reasons that I wanted to pursue radiography. I sort of found out about it in A levels, during my A levels, and I just really liked how they sort of help behind the scenes, and they get to see so many different patients. Being on placement, I'm away from my friends and family, and it's very difficult, to be honest. It's quite isolating sometimes. It's quite lonely sometimes, but it's okay.
I think last year our problem, we were on placement when they kind of told us to go home and not go back to uni, and that cut off the second placement, which kind of affected me because mine was in Neath, so I ended up missing out a lot of kind of what I was learning.
I think the hardest thing about being on placement currently would probably just be talking to patients that are critically ill, so people that are really unwell, or say we x-ray somebody for a chest x-ray and we find, say, a tumour or something in there, then it's just knowing that the outcome of their visit is not going to be the nicest, and just dealing with patients who are really critically unwell is not very nice.
I kind of have a feeling I might be the ward that I'm on's respiratory. I have a feeling I might end up with contact with COVID patients. They seem to come from everywhere. It's like wherever there's a bed and it's safe to put them in, they generally end up there. We're just an extra helping hand, really, and we can just reduce the amount of jobs nurses have to do and all the other healthcares. They get helped out with that. And kind of as it progresses, I think we're going to end up just keeping on helping with the COVID patients until it dies down a bit in the hospitals and just helping out that way.
Coronavirus has really quite heavily impacted our course. So last year, when I was in a first year, half our course was cut off.
It's been quite quiet with the whole support of the uni. Like with the COVID vaccinations now, we haven't really heard loads about it. And then when we've been on placement, there's not been an awful lot telling us what to do with COVID.
I think that university support has been quite mixed during this pandemic. I think for our specific course, they've done quite well, since we're back in placement already and we can still learn. Working with patients in radiography in hospital is quite close contact most of the time, but there are some ways you can get around it. But I think to give appropriate and nice patient care, you have to sort of be close with patients anyway. So I prioritize that over making sure that I'm safe. I want to make sure that they are safe and happy.
On my first ward that I'd ever been to, there was one patient, and he was just very kind of like easygoing, and he'd make sure he knew like I was a student and would make sure like I'd see everything that was going on. And I don't know, you just kind of build a bond when someone's like that. They talk to you a bit more as well. You get some patients that don't talk an awful lot. They kind of like to keep themselves to themselves.
Yeah.
So it's like quite a strange one because you see everyone in like the hospitals, and like a lot of the time very sick people that generally has had COVID. And you do think like when you see big parties and groups of people gathering, you think that's like kind of the most irresponsible kind of thing of it, is where it's a massive group of people. It's just such a risk when it's a big group because it just spreads so easy. Like I was in with full PPE and the patient had PPE on and I still managed to get it. So if someone at that party's got it, you're going to have it as well.
Hi. So I'm on my first break of the day. So my basically my tea break. I've got a coffee, a mocha. I've never tried a mocha before. So I'm excited. Basically we've just been. I'm supposed to be on mobile, so I'm supposed to be walking around the hospital, but it hasn't been any yet. So I've just been doing some normal X-rays. So we did for like there was 2 kids, so we did like hips, x-rays some hips for 2 kids, and there's an elderly gentleman we did an abdomen for, which you don't see abdomen x-rays very often, so that was fun.
I remember just going on thinking, I've got no idea what I'm doing. And they knew that you're in your second year, so they just say, right, can you go help this patient eat? Can you wash the patient? Can you change their beds? And I was sat there thinking, I can't remember how to do any of this. I was doing the first bed back and it made a mess of it. But you do kind of feel like you jump straight into it, like calling doctors and things. It's things like I haven't done before. And they're like, oh, just call this doctor and ask him what medication he needs. And you're sat there thinking, I've got no idea what I'm going to say. You feel like there's a lot of responsibility on you, especially when you're writing your name on things. Like you thinking, right, have I done this right? Because I'm putting my name on there and they're going to come back to me if I've done this wrong.
I think the way that the government has dealt with coronavirus might not have been the best. I think everything's a bit slower, especially with students. I'm not 100% sure that we were their first priority. I think for our specific course, they've done quite well since we're back in placement already and we can still learn. But for some, it's just they don't want to be involved with this as now, especially with COVID around. So I understand that it's quite a risky place to be in a hospital at the moment.
Yeah, I think for me, I'm lucky because I'm doing like nursing. It's quite practical and you can't really stop because of COVID. So I think I've been lucky because we've been out in like the time now with the pandemic. We're out still learning. So whenever now in the future, if there's ever another thing like this, we'll kind of at least be prepared for it.
And I think it's quite heartbreaking sometimes to see it, especially being in that environment where I can see all the frontline workers and see how mentally challenging it is. I just wish everyone would think twice before they did things, maybe.